Here is your station. Right. So if you've read and understood, considering its surgical pathology station, please tell me what differential diagnosis would you consider after reading the stem?
Yes, this may be esophageal cancer,
Yes.
either adenocarcinoma or squamous cell carcinoma, and
Yes.
maybe
And
achalasia,
okay. And it's two.
uh,
Please.
and also neurological disease like myasthenia gravis, Guillain-Barré syndrome.
What investigations would you ask for to confirm your diagnosis?
Upper GI endoscopy plus biopsy.
Okay. Right. Right. Okay. What risk factors do you consider in patient's history that you can think of which will confirm your diagnosis?
Okay, this patient is a smoker, and
Okay.
also he has history of gastroesophageal reflux disease.
Yes. Right. Okay. Can you please tell me what are the genes which can be involved in the involvement of esophageal carcinoma?
Would you please escape this question for me, please?
All right. Okay. We'll come back to this one later. Can you please tell me your second was eclasia? Can you define eclasia?
Yes, it is a failure of relaxation of the lower esophageal sphincter.
Okay. What are the causes of eclasia?
This is maybe due to neurological cause.
Are you sure?
No.
Okay. Here, patient has also lost 8 pounds of weight. So, yes, if we just go with your provisional diagnosis, considering it esophageal carcinoma. So, can you tell me what are the different types of esophageal carcinoma that you are familiar with?
This is adenocarcinoma.
One is adenocarcinoma, but okay. Tell me the histological lining of esophagus.
Non-keratinized stratified squamous epithelium.
Throughout the esophagus?
Yes.
No. In the upper 1/3, middle 1/3, and the lower 1/3. Please tell me accordingly.
The non-keratinized, it's upper third keratinized.
Yes, and middle and lower, please.
Lower non-keratinized stratified squamous epithelium. This is lower.
Okay. What about the middle? Mixed?
Mixed,
Made
yes.
up of. All right. Please tell me the blood supply of the esophagus.
This is from upper part of the esophagus from the inferior thyroid artery, and lower part of the esophagus from the left gastric artery, and the middle of esophagus branches from the thoracic aorta.
All
Esophageal
right.
branch from the
How
aorta,
would
yes.
you manage this patient?
This is
You've
according to
already,
the stage.
yes, yes, please.
Yes. According to the stage, if operable, may I do mucosal resections, submucosal resections, or esophagectomy, McQueen or Ever Lewis, plus feeding genostomy, plus chemoradiotherapy.
All right. This
If
management you've told me when carcinoma is where. Please tell me if there is carcinoma in the upper part of the esophagus, middle, and the lower, and what treatment can be offered to this same male, depending
yes,
upon the site of the carcinoma.
okay. First, I will involve multidisciplinary team.
Yes.
For the upper part, I will do McQueen.
Okay.
McQueen operations plus chemoradiotherapy.
Right.
And the lower for the middle part and the lower part, I will do Eber-Lewis
Okay.
plus chemoradiotherapy and plus feeding genostomy.
Okay. Right.
And if it is unoperable, I will do palliations
Yes.
by
And
self-expanding metallic stent,
yes.
debulking,
Yes. Yes.
and feeding
Chemoradio.
genostomy
Yes.
and chemoradiotherapy.
Right. Okay. What advice would you give to the patient in order to help him reduce the risk factors? Can there be any advice you can give
Yes,
to the patient?
cessation of the smoking.
All right, then change of lifestyle, right? Okay.
Yes, and change of the lifestyle by weight reductions to decrease the
Weight
girth.
is already, he's reducing weight, unintentional. Anything else? Because depends upon the stage of the carcinoma.
Yes.
That's when you'll decide what diet patient can tolerate and how frequent. Okay, right.
Okay.
What more? Okay, how would you stage the esophageal carcinoma? Please tell me.
Yes, by CT scan, chest, abdomen,
Yes,
and
yes,
pelvis. Also, I will do upper GIT endoscopy plus endoluminal ultrasound.
yes, yes. And
Also, but
histologically,
and histologically by biopsy.
yes. All right. You've done the biopsy and it has been confirmed that it is esophageal carcinoma. Now, with which classification you'll consider the grade or the depth of the stage of the carcinoma?
Yes,
TNM
by
classification. Yes,
TNM classifications.
yes. So how would you, please tell me, how would you consider if patient presents with metastasis to the liver, how
Mhm.
would you think that this condition is according to TNM, at
Yes,
which level? Yes, at what
it will
classification?
be M1,
Okay.
and it will be stage 3 or 4 with this is
T
metastasis.
and N, 1 or 2,
Yes.
because there could be regional lymph node metastasis. That's why M is 1. Right.
Okay.
Okay. Yes. Right. What are okay? This I've already asked. Right. Yeah, 30 seconds are left. Okay, can you please, would you be able to tell me the pathogenesis behind esophageal carcinoma? The mechanism behind it?
Yes, this is due to the acid reflux for long times. This induced metaplasia
Okay.
from the non-keratized stratified squamous epithelium to the
Yes.
columnar epithelium plus globlet, and then to the dysplasia, and then to the carcinoma,
Okay.
adenocarcinoma.
Right. Okay. Thank you.
Thank you.